Hi, my name is Dr. Sean. I'll be your emergency room physician. Thank you for choosing St. Rames. So before we get started, the person next to you behind that curtain has been awake for a long time and they finally just got to sleep. That's kind of why I'm talking in this lower tone. And just as a courtesy, I think we should continue talking quietly, just so they can maybe get some sleep. It's pretty hard to get sleep in the emergency room. What brought you in today? I read on your chart that it's abdominal pain, but I wanted to hear your story first. Okay. Okay. Yeah. Abdominal pain is really common. We see it a lot with younger kids and older adults. But what you're describing to me sounds really new. You might answer me some questions first. Have you vomited at all since your abdominal pain started? Yes, okay. And is your pain, does it get worse, like when you eat food? You can tell? Okay. How about with movement? Are you able to like jump up and down? Does it hurt when you're walking? Oh, it hurt when you were driving over today. There's some speed bumps out in the entryway. Did it hurt when you went over those speed bumps? It did? Okay. So, I'm a little concerned for something specific called appendicitis. It's extremely common. But before we continue, I'm going to go ahead and do a physical examination. My scribe is the person with the laptop over there, and I'm going to be telling them what I'm seeing here, what I'm feeling, and they'll be writing that down. So don't be alarmed if I say any big fancy words or if anything sounds scary. I'm just telling them my findings. Okay. You can go ahead and say pupils are pearl, skin warm and dry, moist mucous membranes. No. Alright, I'm gonna go ahead and poke on your stomach. Just, it might hurt a little bit, just let you know now. Don't hit me or anything. Does it hurt when I press here? Okay, how about here? Okay. Over here? No? Alright, so I'm pretty sure it's gonna hurt when I press here, so just bear with me for a second. How about here? Yeah? Okay. Does it hurt when I press in? Okay, how about when I press out? Or release? Yeah? Okay. You can say positive McBurney's point tenderness, right lower quadrant tenderness, abdomen is otherwise soft. Okay. That's a pretty concerning sign for appendicitis. I mean, not concerning because appendicitis is really easy to deal with, but it usually involves surgery. I think just to confirm this, we should get a CT scan of your abdomen. It's a really safe scan. It just involves you laying in bed. One of the nurses or technicians will come by, pull you out, take you to the CT room. They'll run the scan, bring you back. I'll get a notification on my computer that it's been done. I can look at it. It'll take some time for the radiologist to read it and give me the final impression. But once I see that, I'll come back to you. If it is appendicitis, it's likely that I'll contact the general surgeon of the hospital. They'll come down and speak with you, and it'll likely just remove your appendix by either tonight or tomorrow morning. You know what an appendix is? Oh, yeah, I can explain that to you real quick. So, your abdomen is this lower part, so that your rib cage is right here. Everything below that is going to be considered your abdomen. You have your stomach in there, your liver, your intestines, your spleen, your pancreas, bladder, all that stuff, right? So on the right lower side of your abdomen, we call that right lower quadrant, there is a small little duct called the appendix. It hangs off of the large intestine. For a long time, we don't really know what it did. Some popular theories right now is that it contributes to the microbiome of your gut, kind of like a storehouse in case your large intestine gets flushed and your microbiome gets destroyed. Your appendix will be able to hold on to like a little sample of what's been going on in there. You can use that to grow back your microbiome. Otherwise, your appendix is just this benign organ that doesn't really serve a purpose that we know of. People live without it all the time. There's not really a concern with taking it out. So, just be at ease. If you do have to take it out, it's not a huge deal. It's also a really common surgery, so I'm pretty sure insurance will cover it. Do you just have the standard state insurance? Okay. Yeah. The hospital also has some great payment plans and financial assistance if you do need that. It's super common, so don't feel ashamed for reaching out to the hospital for help. Yeah, I mean, we could be lucky. It could just be constipation. You could just be really backed up in there. Yeah, constipation can cause pain like that too sometimes. It happens a lot more than you think. Yeah. Okay, well, I'm gonna go ahead and finish off my physical exam. I'm just gonna get my stethoscope and listen to your lungs and your heart. Take a deep breath in. Okay. Have a deep breath. Good. Good. Okay. Yeah, my airway clear, no wheezing, no rales. Mildly tachycardic, but don't write that down yet. Come back and check later. It might just be because we've been talking about appendicitis and whatnot. Yeah, so it'll be a little bit. I've obviously got a lot of other patients to see, but I'll make my way around and check on you now and then and see how you're doing. If you have any concerns, just press the call light, communicate with your nurse. Your nurse will communicate with me. That's probably the fastest avenue to get to me. I'm going to go ahead and say no eating or drinking for the duration of your stay. It's just standard practice prior to a surgery. If you do need to be sedated for a surgery, there's just a risk of vomiting and of course like choking on your vomit, which is not great. So go ahead and just limit yourself to some ice chips. Aside from that, nothing to eat, okay? Alright. Well, I'll be in touch. Hey. So, I went ahead and read over your CT. It looks like you have some inflammation around your appendix. It hasn't perforated, which means it hasn't exploded. So that's a good sign. The inflammation is just appendicitis. So I'm definitely going to call the surgeon and have him come down and speak with you. Your labs all look pretty normal, all things considering. You're slightly anemic. I'd recommend maybe eating some iron-rich foods. Anemia is pretty common, but nothing too out of the bounds. Yeah. So yeah, the surgeon will be down here to speak with you. You'll be getting a room up in the hospital, a lot nicer than our emergency room. Your nurses will communicate with you, get all your things situated. Any visitors you have can, of course, come see you. I think the hospital closes like around 9:30. So after that, any visitors aren't going to be staying with you during the night. We'll probably have to go, but of course, feel free to have someone be there with you. Yeah, it was nice meeting you. I hope everything goes well.